On the Medical Watch tonight, to boost or not to boost?
As the questions mount, medical reporter Dina Baer has some answers about COVID boosters.
The White House Coronavirus Task Force says you need them. FDA health experts say wait. Vaccine makers, who stand to make a lot of money from boosters and beyond, are moving full steam ahead. But the real question tonight is whether vaccinated people are at risk for COVID without a booster. Our experts weigh in.
Every transmission and replication event is a chance for a variant.
So the more COVID spreads, the more it changes. But according to recent U.S. studies from Utah, Virginia, and Washington State, a vaccinated person has a 1 in 5,000 chance of getting infected with COVID in the most rampant areas. In areas with high vaccination rates, only a 1 in 10,000 chance. The Washington State Department of Health reveals 1 out of every 1 million vaccinated people in Seattle has been admitted to the hospital with COVID.
One thing we may not see is that these booster doses have a marked effect on declining the rates of transmission. That may not happen, and that may not happen because so many people still haven't gotten a first dose.
Infection rates in least vaccinated states are 4 times higher. For that reason, health experts agree initial doses are more critical than boosters.
The focus right now should be really getting everyone their primary series, and then the boosters.
That advice is not the same for older people and those who are immune compromised, because their immune system may not have gotten the biggest thrust from the first vaccine. Otherwise healthy people are not getting severely ill after their COVID shots. According to the CDC, vaccine immunity is robust even after 6 months and against the Delta variant. Vaccinated people are not being hospitalized.
Those boosters right now are recommended for those individuals who are at the highest risk of hospitalization and even death and severe illness.
As for the booster shots, they're really just a third dose of the vaccine, currently the same one that was created before the Delta variant.
The booster shots that are being recommended are the same medication that was in the initial 2 doses of the Pfizer or the Moderna, but it's going to be given again in order to help remind the immune system to continue making antibodies and to make more.
Drug companies are working on yet another vaccine to specifically address the variants. But even then, spreading infection may put science behind the sneaky, ever-changing virus.
Some people wonder whether or not we shouldn't wait until we have an opportunity to create a new vaccine that's designed specifically to respond to the Delta variant and other new variants. However, waiting for that will again put us a little bit behind the 8 ball, because we're on Delta now, we'll be on the next variant very soon.
That's why infectious disease specialists say Delta is not the biggest problem. Vaccine hesitancy is. In more than 99% of cases, healthy vaccinated people are not getting sick, even with Delta, and have a minuscule chance of spreading any form of the virus that causes COVID. Back to you.